Good morning, good afternoon, good evening, depending on the time you are watching this video. I think those three will apply for you. Welcome to the new episode of the Weekly 5. This is the second episode. If you haven't watched the first part of the Weekly 5, I urge you to go back and watch it first before coming to the episode 2. If this is the second episode, continue watching and continue um, and do subscribe for more episodes. As usual, my name is Wali Shega Munyere and I'm the Yule Daktari. Welcome to the second episode. So in this episode, the scope for this uh, week, which is week 6, will be the anteromedial thigh, the femoral triangle, the Hunter's canal, which is also known as the subsartorial canal or the adductor canal, the hip joints, and as usual, 5 questions, each has 3 parts. Let's start with the first question, which tests our knowledge of the femoral triangle. So we have been asked to identify structures A, B, and C. So structure A over here forms the base of the femoral triangle, and that's the inguinal ligament. Structure B is the most medial structure of the femoral triangle, and that's the femoral vein. And structure C here, you can see it's a branch from structure D. So structure C is the deep femoral artery or the profunda femoris artery. So those are the structures within the femoral triangle. Then we have been asked, name 3 branches of D apart from the terminal branches. So structure D, first you need to identify it, and the correct identification of D is the common femoral artery. I know some texts will tell you femoral artery, okay, but I like to call it common femoral artery because from the common femoral artery, the terminal branches in this case will be this superficial femoral artery, which will proceed to the Hunter's canal, and the deep femoral artery, which we have just named. So what are some branches apart from those terminal branches? So within the femoral triangle, the common femoral artery gives rise to some various arteries, and these include the superficial external pudendal artery, which, as the name suggests, proceeds to the groin. Also, the deep external pudendal, which also proceeds to the groin. Then the superficial epigastric artery, which takes an upward course towards the umbilicus, and the superficial circumflex iliac artery, which takes a course towards the anterior superior iliac spine to participate in what is known as the iliac anastomosis. Now, name the structure pointed by the green arrow. So I hope this is green, yeah. So this structure here, if you follow it, you can see it's coming from the femoral nerve, and it is a structure which is proceeding into the adductor canal, okay? So this structure most likely is the saphenous nerve, which is the only cutaneous branch from the posterior division of femoral nerve, and the distribution, it has cutaneous, it's the one responsible for the cutaneous supply for the medial aspect of the leg and the foot up to the level of the first metatarsophalangeal joint, okay? So it supplies the medial aspect of the leg and the foot up to the level of the first metatarsophalangeal joint. Okay, so that is it for the first question. Now, on to the second question. The second question is testing your knowledge of the muscles of the anterior compartment, um, anterior compartment of the thigh. So we have been asked to name structures labeled A, B, C. So structure labeled A there is that muscle, and if you have named that as sartorius, that is very correct. B over here, that is vastus medialis, one of the 4 heads of quadriceps femoris. And structure C over here is vastus lateralis, the second head of the 4 heads of quadriceps femoris. Okay, then we've been asked to state the innervation of D. So D over here, can see D is attaching to this structure labeled E. So D is attaching to the anterior border of E, and E, by now you should know that E is the iliotibial band, ITB, the iliotibial band. So structure D, which attaches to the anterior border of the iliotibial band, that is your tensor fasciae lata, and the innervation of tensor fasciae lata is the superior gluteal nerve, and if you can remember the root value, it's L4, L5, and S1. We've been asked to state the distal attachment of E. So what is the distal attachment of the iliotibial band? Where does it attach distally? And it attaches on the anterolateral aspect of tibia, on what is known as the Gardis tubercle, okay? The Gardis tubercle, and this is the location of the Gardis tubercle, okay? That is the location of the Gardis tubercle over there. Okay, so on the anterolateral aspect of a tibial, please don't confuse it with the tibial tuberosity, because on the tibial tuberosity, this is where the patellar tendon attaches, that the quadriceps femoris tendon attaches there. So please be keen as you identify the Gardis tubercle on the tibia. Okay, the third question is testing your knowledge of the hip joint. So I have just named the joint is the hip joint and classify the joint. So the type is a synovial joint. That is the type. The variety is a ball and socket. Okay. And then identify A and B. So structure A and B. So structure A, you can see it is attaching here. And this is the anterior inferior iliac spine. And then it is attached to the intertrochantelic line. Okay, the intertrochantelic line over there. So that is the iliofemoral ligament. The iliofemoral ligament, and the iliofemoral ligament prevents hyperextension of the hip joint. Okay, it prevents hyperextension of the hip joint. Structure report B, you can see it is attaching to the pubic eminence, the iliopubic eminence, which is there, the iliopubic eminence, and then attaches to the it somehow blends with the capsule of the hip joint, and that is the pubofemoral ligament. Okay, the pubofemoral ligament, and pubofemoral ligament prevents hyperabduction. Okay, hyperabduction of the hip joint. Okay, the hyperabduction of the hip joint. So identify structure labeled C. This here is the femoral head, and state its major arterial supply. So the head of femur in children, the major arterial supply is the obturator artery. So the obturator artery gives a branch which passes through the round ligament, or the ligament of the head of femur, which is also known as the ligamentum teres femoris. So there is an artery which passes through that ligament, and that is the major arterial supply in children. But for adults, rather after the age of, it is said, 7 years, that artery tends to atrophy, and it is replaced by the trochanteric anastomosis, and majorly the medial circumflex femoral artery, which gives rise to the retinacular arteries, which pass along the neck of femur to supply the femoral head. Okay, so you need to understand what are the arteries which participate in the trochanteric anastomosis. I hope you did that. I think that was one of the objectives covered in the previous week. Okay, we are done with that question. On to the fourth one. Now, the fourth question is testing your knowledge of the medial compartment of the thigh, and you've been asked to identify structures labeled C, D, and E. So structure labeled C is this muscle, okay, this muscle over here, and you can see this muscle is sandwiched. It's sandwiched between nerve B and nerve E. So it's sandwiched between the two. You can see it's sandwiched between the two. B lying on the anterior surface, and E lying on the, it lies on the posterior surface of structure C. So once you see a muscle in the adductor compartment with such layout, that muscle is the adductor brevis. Okay, adductor brevis is sandwiched between the two divisions of obturator nerve. Obturator nerve. Then structure D, you can see structure D now lies on top of C, and structure D, the muscle is adductor longus. So adductor longus lies on top of adductor brevis, and structure E here, E, which lies between now C and this muscle here, which I'll name as K. So structure K is adductor magnus. So the nerve between adductor brevis and adductor magnus, that's the posterior division of obturator nerve. The root value of obturator nerve is L2, L3, L4. You'll notice that femoral nerve also has the same root value, but for obturator nerve, this comes from the ventral division. I said ventral division of the ventral rami. Okay, so the ventral division of the ventral rami of L2, L3, and L4, that gives rise to the obturator nerve. But the posterior division or the dorsal division of the same ventral rami gives rise to the femoral nerve. So both nerves come from the ventral rami of L2, L3, and L4. Only that obturator nerve comes from the anterior division, whereas femoral nerve comes from the posterior division. Okay. Now, name A and state in its innervation. The structure about A here. If you have identified A as obturator externus, that is very good of you, and it inserts into the trochanteric fossa. So how have I known it's the obturator externus? You can see that this here is that's the obturator canal. Okay, remember in life, the obturator foramen is covered by the obturator membrane. It only leaves a small opening at the top, the obturator canal, through which the obturator nerve passes through. So attaching on the anterior surface of the obturator membrane is the obturator externus. Okay, obturator externus, and you can see the muscle fibers are oriented in that direction. Okay, as they go to insert into the trochanteric fossa. Name B and one muscle that it supplies. Structure B here is now the anterior division of obturator nerve, and some muscles it supplies the muscle label D. So adductor longus. Structure label C, adductor brevis. It also supplies pectineus and glacidis. Okay, so here also add pectineus. Pectineus, great. Those are the structures which are supplied by the anterior division of obturator nerve. On to the final question, which is an arteriogram. Okay, so name A and the three branches it gives apart from B and C. So you can see this here is the outline of the femur. So by now you know which vessel you are looking at. So, or which artery. So A is the common femoral artery. Okay, so name three branches apart from B and C. I think we had said this. So the superficial external pudendal, the deep external pudendal, the superficial epigastric, and the superficial circumflex iliac arteries. Name B and three branches it gives off. So B here, you can see which takes somehow a lateral course. Okay, so but you can see it has very many branches within the thigh. So B is the deep femoral artery or the profunda femoris. And what are some branches? It gives off the medial circumflex femoral artery, the lateral circumflex femoral artery, and for sure this here. This here is the lateral circumflex femoral artery. This one, let me point it. Yeah, that one there, you can see it. That there is the lateral circumflex femoral artery. Okay, the lateral circumflex femoral artery. And then it also gives rise to the perforating arteries, which perforate through the substance of adductor magnus to participate in the longitudinal anastomosis. Name C and describe its fate. So B is the deep femoral artery. C becomes the superficial femoral artery, which now enters the adductor canal, where it gives rise to some muscular branches and also the descending genicular artery, which will go to participate in the genicular anastomosis. And it ends as the popliteal artery at the level of the adductor hiatus. Okay, and so it continues as the popliteal artery at the level of the adductor hiatus. That is the fate. And with that, we have come to the end of this week's weekly 5. Stay tuned for next week's weekly 5. But before that, I'll attach a playlist where you can get detailed anatomy videos, and I'll put it somewhere here. Yes, I'll put it somewhere there. Then, so please click that so that you can see these detailed anatomy videos which I made a while back when I was a first year, so that you can get in-depth knowledge. This was just let us call it a preview of what you should know. Okay, so please do subscribe for more episodes, and have a great weekend ahead. Thank you.